Hello everybody, my name is Ololade Adekoya, a student at Brandman University. This is my stakeholder education plan as it relates to my CSP on influenza. I am a family nurse practitioner that currently works in a family practice, and I'm very passionate about this topic. Influenza, commonly known as the flu, is a contagious respiratory illness that is caused by the influenza virus, and it is preventable by getting the vaccine. Influenza is a common illness in society today that can affect anyone, regardless of your age, race, sex, and socioeconomic status. My clinical scholarly project is on influenza and the importance education plays in increasing the rate at which people get vaccinated in order to prevent hospitalization. Influenza is a serious disease which can lead to mild to severe illnesses that leads to an increased rate in hospitalization, mortality, and morbidity, which overall affects the health of the public. The clinical problem is people do not want to get the influenza vaccine. Despite the tons of research available on the benefits of being vaccinated, some people have preconceived ideas why they should not receive the influenza vaccine. That is why I chose the topic, and my PICO question is, in adult patients, how does an educational program compared to no education affect the number of people receiving the influenza vaccine in a 3-month period? The implementation of my clinical scholarly project will be conducted in a family practice setting. I plan to utilize a survey or a questionnaire during the project. It includes a team of people who will be referred to as my stakeholders. I would like to talk about the stakeholders at this point, and my stakeholders include the patients, the clinical staff, which includes the nurse practitioner, medical assistant, and the receptionist. Each of them play an important role in the whole process. First of all, the first line of contact will be the receptionist. His or her role will be responsible for scheduling the patient, giving the patients the form, and following up with them. The medical assistant will also be required to help the patients fill out the forms once they get into the room, and also they are responsible for taking vital signs and just making sure the patient is comfortable before they see the nurse practitioner. The final person in this process is the nurse practitioner. She will be responsible for providing education regarding the benefits of getting vaccinated and addressing any questions or issues the patients have. The role of the nurse practitioner will include explaining what the consent form entails, and also they inspect all the documentation that will be given to the patient regarding the subject of influenza. There will be a daily log that has all the patient's responses. Remember, this project is for 3 months, so the log will be done on a daily basis. The goal is to get as many patients vaccinated and to change the minds of those who hesitate about receiving the vaccine. The study is for 3 months and documentation is key so that the team and I can properly measure the outcomes of this study. The ultimate goal of this study is to get many patients vaccinated and to change the minds of those who have hesitation about receiving the vaccine. Also, our main objective is to improve health outcomes by preventing hospitalization, reducing healthcare costs as it relates to influenza-related illnesses. Education is key in getting the point across and in talking about the importance of getting vaccinated. Our role as providers is to educate people about the importance of the vaccine and try to reorient them from their preconceived notions. Now we get to the point where I'll be talking about the theoretical foundation and the conceptual framework. The theory that I've chosen to explain the clinical problem at hand, influenza, is the health belief model because it has shown to be relevant in several health behaviors, including vaccination compliance. The health belief model is a systemic method to explain certain types of belief patterns. It focuses on the relationship between health behaviors and the utilization of health services. The health belief model, often known as HBM, is divided into 4 categories, which are perceived susceptibility, perceived severity, perceived benefits, and perceived barriers. Perceived susceptibility is a generated opinion a person has of getting the condition or ailment, while perceived severity is a person's opinion regarding the severity of the condition and the consequences attached to it. On the contrary, perceived benefits involves a person's belief in the efficacy of an advised action to minimize the risk of severity of the impact, while perceived barriers is a person's opinion on the tangible and psychological costs on an advised action. In relation to the clinical question, the reason to get the influenza vaccine are based on individuals' opinion about getting the influenza vaccine. It also includes their beliefs on the severity of influenza, their perceived benefits of the vaccine in preventing influenza, such as is it really worth getting the flu shot, and their perceived barriers in getting the influenza vaccine, such as is it really convenient. Overall, the goal of my CSP can ultimately reduce healthcare costs that are associated with influenza because receiving the influenza vaccine has been shown to prevent complications, influenza-associated medical illnesses, and acute respiratory illnesses. This brings me to the end of my presentation, and I hope you've learned a thing or two about influenza and all the associated illnesses related to it. I've also explained about the stakeholders and also about the health belief model that supports my subject. Thank you so much for taking the time to listen to me, and have a great day.